Hello, I'm Foojan Zeine, and welcome to the Inner Voice Show, where we explore all that matters in your life from a psychological perspective. Today, I'm so excited and honored to have Dr. Claudia Black join us. Let me tell you a little bit about her. Since 1970s, Dr. Claudia Black's work has encompassed the impact of addiction on young and adult children. She offers models of intervention and treatment related to family violence, multi-addictions, relapse, anger, depression, and women's issues. Her writing and teachings have become a standard in the field of addiction. Dr. Black holds a doctorate of philosophy and social psychology from Columbia Pacific University. She's an author of more than 40 books, audio CDs, and videos for families, individuals, and professionals. She's a senior fellow and addiction and trauma program specialist at the Meadows Treatment Center in Arizona. She's one of the original founders and serves on the advisory board for the National Association of Children of Alcoholics and the Advisory Council of Moyer Foundation, and its development of Camp Mariposa, a camp for children impacted by addiction. Dr. Black has represented World Service Al-Anon family groups on Capitol Hill and on Parliament Hill in Ottawa, Canada. Her workshops have been presented to an extraordinary wide area of audiences, including military academies, prison systems, medical schools, and extensive mental health and addiction programs. Claudia has extensive multicultural experiences working with agencies and audiences in Mexico, Japan, Brazil, Australia, Scotland, Iceland, Germany, England, and Canada. Many of her books and videos have been translated and published abroad. She is the recipient of a number of national awards, including the Marty Mann Award, the CCAT Award, the National Council on Alcohol and Drug Addiction, Educator of the Year, the 2004 Distinguished Alumni Award from the University of Washington School of Social Work, and 2010 Conway Hunter Award for Excellence in the field of addiction. That is so true. She's excellent in this field. She has written articles for many professional magazines and journals, among them Paradigm, Recovery Today, Counselor Magazine, and has appeared on national television and radio programs. Dr. Black, welcome to my show. It is so nice to have you. I've been present at many of your conferences. I've learned so much about addiction, and I've worked with addiction and addicted families for over 25 years. And you have been such a jewel and a gift to me, the other therapists, and whomever has worked in the field of addiction. So welcome.
Well, thank you. Thank you for having me, for honoring the subject, because it's so pervasive wherever we're at in the world. And I'm also very touched that I'm being interviewed by somebody who actually knows the issues with the experience that you have as well.
Now, for our audience, let's first define what the word addiction is. I get so many of this question which says, you know, I drink socially. I use once in a while. Why can't, as the whole world is doing this, and you know, marijuana is becoming, trying to become legal and becoming legal in some of the states. And it's, well, how do I know I'm addicted when I already know that, hey, I can cut it out anytime I want? So let's define addiction first. Okay.
I think that typically addiction does not so much have to do with the amount that a person is drinking and or using. It really has much more to do with the impact that it ultimately is having on a person. Now, you often hear people who are addicted saying, oh, I can stop anytime I want. I simply don't want. So we have to be a little bit cautious when people throw out that caveat. When you define addiction, what you're looking for are a variety of different characteristics. And one of those is that we become increasingly mentally more and more preoccupied. We're anticipating our next drink or our next toke or whatever it is that we're engaged in, because addiction goes beyond. Initially, in my work, we focused on alcohol and alcoholism. And today, you can be addicted to truly any substance. And today, you can be addicted to a lot of different behavioral processes as well. So first, I would take a look at people's mental preoccupation, the anticipation of, such as I get up in the morning and I start to plan my day knowing that what it is that I'm going to do when I get off work often has to do with lighting up or having that first drink, or I know what I can get away with maybe even in the context of the day. or I'm busy looking forward to the weekend. The weekend's just over, and I really try and not use anything during the week, but I'm already thinking about how I'm going to go out and party next weekend. So preoccupation is very significant. The inability to predict your behavior. You used to be able to say, you know, I can go out and I can have a couple drinks and I'll be home by such and such time. Now you go out with that intention, but you don't just have a couple of drinks. You have 2 and 3 more than what you thought you were going to have, and you find excuses for not following through with the commitment that you were going to follow through with. So again, that's called loss of control, the inability to predict, in essence, how much you're going to use and what it is you're going to follow through with as well.
And now you also have created the term adult children of alcoholics or adult children of addicts. Say more about that term by itself.
An adult child from an addictive family system is simply meant to be somebody who was raised with addiction. They're now of adult age, but there's so much more meaning behind. That's sort of the literal. That's somebody who was raised with addiction throughout their growing up years. And the meaning that's come with that is, what are the consequences? Because so oftentimes when you're raised with addictions, the negative consequences don't show themselves until somebody reaches adulthood. So the term actually implies all that comes with that history of growing up with addiction.
It's interesting because many of the people who have been raised in the addicted family, at the beginning you actually hear the children hating that substance or the effect that it actually has on their mother or father as they get addicted. And then many times the family members who are addicted or the adults say, no, my child will never be addicted, because they already say they hate it. And yet as they grow up, it seems like they follow some of those behaviors consistently. So how does addiction by itself enter into the family and affects the family members, whether it's in a spouse or their children?
First of all, if I take children who are raised with addiction and they have an awareness that the substance is what's causing a lot of the problems in the family, if I take them at 9 years of age and ask them if they're ever going to drink or use, they will be wide-eyed and say, absolutely not. You take those same children by the time they're 13 and 14 years of age, and they're using.
Yes.
Now, not necessarily in a problematic way, but they're using because that's what their peers and their friends are doing. That's what society says we do in order to have fun. But they're using with the belief that they're going to have the willpower and self-control that a parent did not have. And that's the misconception, that if somebody has enough willpower and self-control, they're going to make sure they don't become addicted. And that's a fallacy. Addiction is not about willpower and self-control. In fact, some of the people, they demonstrate great self-control in spite of their addiction. That's what gets in the way of their ever having recovery. But what I want to come back to is that alcohol and drugs does something for people raised with addiction that it doesn't have to do for somebody else. It speaks, in essence, to what it is they didn't get as a consequence of the addiction in their family. Under the influence of alcohol and drugs, when life has been so serious for me, it makes it easier for me to laugh, for just this moment not to carry the burden of the world on the shoulders. When I don't have much courage because I'm so intimidated and frightened by what it is that's going on in this family, under the influence of alcohol and drugs, it gives me a false sense of courage. And I did say false, but people will take a false sense any day over no sense. Now, that doesn't make them addicted, but it makes them want a second drink and a third drink, a second, third, and a fourth time when somebody else doesn't need that, just to feel normal.
So what I'm hearing from you is that one thing that happens in the family system that is an addict, they don't really know how to handle emotions. They've never learned how to handle emotions. So because the grown-up is using some sort of a numbing device, whether it's a behavior or alcohol or drug, in order to not attend to that emotion and just kind of numb it, that sort of a coping mechanism and behavior is really not taught or is not a norm in that family. So therefore, as the children are also growing up, not learning that sort of dealing with emotions, then therefore they also go back and search for something that numbs that emotion, and they can kind of like move on without ever experiencing or dealing with it. Is that what I'm hearing from you?
Yeah, very much so. Very accurate description. That the norm in the addicted family is you learn how not to talk honestly about what it is that's going on, and you learn how not to show your feelings. And in that process of learning how not to show your feelings, because you've come to learn something bad happens. If I show people my sadness, I get told I have nothing to be sad about. If I show people that I'm angry, they'll tell me that I have nothing to be angry about. People go to great lengths in this family to take away other people's emotional reality. They punish them and they shame them right out of their feelings. So then what happens is I move into adulthood. I don't have the ability not only not to show my feelings, I now can't tolerate them. That we call scientifically sort of a dysregulation. I get very anxious in the face of fear. I get anxious when I become agitated and angry. I get anxious when I become sad. And that's the role that alcohol and drugs can play for me. It'll take away that anxiety as I begin to emotionally experience things that have never been safe for me to experience.
Mm-hmm. Now, you also talk a lot about denial, which we see it as one of the characteristics of addiction. So denial and lying are something that we really see as addicts develop, have really become part of the fabric of their character somehow. Can you talk a little bit about these two pieces in how it works for the addict and then how it impacts the family system?
I think what's hard for other people to recognize is that for the addicted person, that need to drink and use becomes the priority over everything else in their life. And that, from, again, a scientific standpoint, what we understand is the ability to think through your consequences of your behavior. That prefrontal cortex, part of the brain, in essence, shuts down, and that drive for relief, that drive for pleasure is now a stronger drive in our ability to think reasonably through things. And so what you see happens here is that in order for me to drink or use in the way that meets my needs, I have to minimize what I'm doing. I have to discount what I'm doing. Ultimately, I find I rationalize the behavior, and in many cases, I just blatantly lie. And I blatantly lie oftentimes to push people away, people that want to confront me about my behavior. That I may have to go to that extent. The minimizing, the discounting, and the rationalizing is what I really do for myself that allows me to continue to drink and use to the extent I am.
Go ahead. Say more about that.
And the part of that question is not only does the addicted person deny, minimize, and blatantly lie, in time family members come to do that as well. And it's very easy. Addiction is insidious, and there is a progression to addiction, early, middle, and late stages, and it takes time. So in the beginning, it's very easy to minimize somebody's behavior or the impact their behavior is having on them. So I as the child, or I as the spouse, the partner, I rationalize their behavior. He didn't mean to be that rude to me. He just has a lot of stress. That's how I begin to rationalize. And then rationalize increases as their behavior increases. I minimize that it's painful. Oh, it's exactly. He didn't mean that. It really wasn't that scary because it could have been a whole lot worse. By the time kids are 9 years of age in an addicted family, they're learning how to deny. And by the time they're adults, they can be as sophisticated at it as the addicted person is.
As you were talking about this, it came to me that in many cultures, usage of some sort of maybe an alcohol or some sort of a drug or a sort of a behavior, it's a norm. People don't look at it as, oh my God, it's a mental illness or it's a condition or it will create a problem later on in their life. As I recall, in my addiction, in my culture, I'm talking about my addiction, mine's definitely food at this time, but talking about the culture itself. When I look at the culture, I look at a culture that has used opiates for many, many, many years. And when it has used opiates, it's been part of the culture as it has used the opiates. Alcohol became some part of the younger generation as they have utilized it. And then now maybe uppers and different things have become part of the younger generation as they use it. When we're looking at young teen, when they're going to universities, it's part of the culture as they use marijuana, is actually part of the culture as they use it. So when we're looking at some other cultures such as Armenians, Russians, or all of that, you see alcohol, it has become part of that. I think that I've lost them. I'm going to call them back, so give me 2 seconds where I think that I've actually lost the connection with them. So we're going to go to maybe a commercial, and then we'll be right back with you.
خرد زندگی، مجموعه‌ای از CD-های صوتی که شما رو به اعماق وجود خودتون میبره تا آرامش درون، خواب آسوده، رهایی از احساساتی که شما رو آزار میده و با بدن خودتون متصل میکنه به زبان فارسی و انگلیسی. این مجموعه با صدای دکتر فوژان زینی شما رو هیپنوتیزم میکنه و کلمات تلقینی به کار رفته میشه تا شما رو سریعتر به اهداف خودتون برسونه، با موسیقی که به شما آرامش میده و با تکنیک مانو و بیت. برای سفارش این CD-های صوتی با دکتر فوژان زینی در تارنمای foojan.com تماس بگیرید و یا با شماره تلفن 818 648 20